Well, welcome everyone to Reimbursement Readiness, Business Tips for Wound Practice, presented by Kathleen and friends. I am really glad you joined us today because we have been inundated with questions about the implementation of the new payment system for both outpatient departments as well as the physicians. And in episode 17, I did my very best to give you some very good implementation tips. And I hope that that you've actually listened and implemented them. If you didn't have an opportunity to listen to episode 17 and you work in an outpatient department, I hope you will listen to it because these payment issues and processes will not happen by magic in the outpatient department. And similarly, the physicians are very confused because there's many pieces of information and misinformation that are mingled on the internet. So we're really glad to have Donna Cartwright here today. She has been spending a fair amount of her time, like me, answering lots of questions. And she is going to talk about the physicians' frequently asked questions about CTP purchase and application for 2026. Donna, welcome.
Thank you, Kathleen. It's glad to be back and hopefully everybody had a happy new year and good holidays. So on our last episode, Kathleen reviewed with you the changes to the hospital outpatient and provider-based department sites of care. Today, I'm going to speak about the changes that were made to the physician's fee schedule, effective January 1st, 2026. So as a cautionary note, I always want to remind everybody that this information is current as of today's broadcast date. It's your responsibility to stay informed of any of the new changes as they seem to be changing frequently, if not almost daily. So first, let's get into the frequently asked question number one. I tried to cover as many of the new questions that I've been getting, and I've incorporated some that Kathleen have been getting. So hopefully this will help you navigate this new system a little bit better. So how does the 2026 Medicare Physician Fee Schedule final rule impact a physician's office practice that purchases and applies CTPs? So in previous years, physicians' offices were paid at the fee schedule non-facility rate for the application of a CTP. Also, they were paid separately a unique per square centimeter rate for each brand of covered CTP, usually assigned by the HCPCS code of the CTP. Now, in 2026, physicians' offices will still be paid the non-facility application rate. In the office, for example, the national average allowable rate for a CPT code 15275 for the application of a CTP to a DFU less than 25 square centimeters is $160.32, which is an incredible increase from $153.97 in 2025. In addition, the physician's office will still be paid separately for the covered CTPs, but they will receive one uniform payment rate of $127.14 per square centimeter, regardless of the brand. And that's important because obviously we'll get into some of your implementation changes that will be important for this. The next FAQ, number 2, will the national average CTP application rate of $127.14 per square centimeter be geographically adjusted? There's a lot of confusion out there on this because prior to Christmas, it was indicated that they were not going to be geographically adjusted. But in fact, yes, in a last-minute change, CMS announced that the payment rate for the CTPs will be geographically adjusted. And this could create access issues for CTP applications because physicians' practices in some geographic areas, like major cities, will receive payment rates higher than $127.14 per square centimeter, while other practices in rural areas will receive lesser payments per square centimeter And even though the CTPs will actually cost the same. So that's an interesting point, and I wanted to be sure that you note that change in your office charge description masters to reflect your new application allowable rate and your new product payment rate. We have posted a chart that we obtained from CMS on the website, and it provides the CTP's geographically adjusted rate for each locality within the system. So that's an important thing to put on your to-do list. For frequently asked questions number 2, I also wanted to advise you that we have provided a handout that outlines both the facility and non-facility payments for 2026 for the physician office. So you can print that out at your leisure and review that. So frequently asked question number 3 is in 3 parts. So part 1, the first question is, will Medicare continue to pay for CTP wastage via the JZ or JW modifiers? And the answer to that question is no. The JW and JZ modifiers are only used when billing for drugs and biologicals separately payable under the Medicare Part B drug file. The JW and JZ modifiers are not appropriate when billing for incident to supplies, even when the incident supplies are separately payable. So for CTPs, only the product administered portion or the usage of the CTP is billable. According to Medicare, discarded amounts of incident to supplies are not payable. That is very important because before, when you had a full-size sheet, you were able to bill for the whole sheet, documenting the JW and JZ modifier. Now, since there are no modifiers, we have received the instruction that you are only allowed to bill for the product administered portion. So again, very important to note. The reference for this wastage change announcement is question number 9 on the CMS FAQ sheet, which can be found at the link that I gave you on this slide. So I hope you are able to go and review that because that will answer many questions. Should the JW and JZ modifiers be used when billing separately for payable incident to supplies? And again, that answer in number 9 of the link that I provided to you, the JW and JZ modifiers are only used when billing for drugs and biologicals separately payable under Medicare Part B as described in the FAQ number 9, okay? The JW and JZ modifiers are not appropriate for billing for incident to supplies, even if such incident to supplies are separately payable. In addition, discarded amounts of incident to supplies are not payable by Medicare. In current year 2026 Physician Fee Schedule, Physician Fee Schedule Final Rule, and the current year 2026 OPPS and ASC Final Rule with Comment Period, CMS finalized to pay separately for the provision of certain skin substitutes hereinafter referred to as non-BLA skin substitutes as an incident to supply under the Physician Fee Schedule in the non-facility setting and under the OPPS ASC in facility setting beginning January 1st, 2026. And I put the citation there for you. As a result, non-BLA skin substitutes are no longer payable under Medicare Part B as a drug or biological as of January 1st, 2026. And only administered portions are payable, as we mentioned before. For dates of service starting on January 1st, 2026, if a provider or supplier administers an entire non-BLA skin substitute from the package or container and no units are discarded, the JZ modifier is not appropriate when billing Medicare. If a provider or supplier administers a portion of a non-BLA skin substitute from the package or container and a portion is discarded, the provider or supplier may only bill the units that are administered. It is not appropriate to bill Medicare for such discarded units under any circumstances. That is, units may not be billed with the JW modifier, and such units may not be included when billing for the administered amount. So this is a very important change to take note of. And then part 3, what should I do if a local coding and billing article in my jurisdiction still instructs the physicians to report the JW and JZ modifiers on our claims? And the answer to this is you should contact your Medicare administrative contractor or your MAC regarding the discrepancy between CMS's modifier direction and the MAC's modifier direction in the local coding article. The MAC is the only entity that can correct that discrepancy. And another question came up was in order to appropriately fixate CTPs, they should be applied to the ulcer surface over the ulcer margin and extend onto the healthy skin. Therefore, the amount of CTP will be greater than the size of the ulcer. Will the MAC pay the physician for that overage of product? And again, you should contact your MAC to obtain clarification about the amount of overage allowed if the MAC will pay for that overage. So there's been a lot of questions about this. I know many folks have written in and asked this question, and should we become aware of what the answer to that question is, we will certainly post that for you and whatever the reference material are that goes with it. So frequently asked question number 4, how did the 2026 Medicare payment changes impact non-sheet products such as gels, powders, and flowables? This is a question that always comes up, and the answer is Medicare will consider these products as CTPs and incident to supplies in the physician's office and will pay for them separately if they are covered. The rate for the non-sheet CTPs is determined by the individual MACs, and once a MAC determines an allowable rate for a non-sheet product, they may publish it on their website. The HCPCS code and the rate for that product on the physician fee schedule, which is always located on their website, and there's usually a link for it there. Again, please remember that only billable services associated with the application of non-sheet products are either debridement if performed or an E&M visit. That's it. You're not allowed to use the 15271 to 15278 for the application of these products per CPT coding guidelines. So the frequently asked question number 5, what happened to the LCDs that were supposed to take effect on January 1st, 2026? Well, as I'm sure all of you are aware, the LCDs were withdrawn effective December 24th. That was our Christmas present. Therefore, coverage in 4 MAC jurisdictions will be based on reasonable and necessary. Novitas, First Coast, and Cigna all have active LCDs, but they do not include the listing of covered, non-covered CTPs. Coverage for each brand of CTP will continue to be based on medical necessity. And in addition, 4 states in these jurisdictions are part of the WISER prior authorization program, which Kathleen will be talking to you about in a future episode. So again, note the reimbursement readiness will have another episode, as I said, and that will strictly focus on the WISER program coming to you soon. What happened to the CTPs that are listed on the Medicare Part B drug file? As you may have seen, the ASP data are no longer required to be submitted by CTP manufacturers due to the change in payment amount from a drug biological to a separately payable incident to supply. This is also why the wastage is not reported anymore. Therefore, CMS removed all the CTPs from the ASP file. So that's why you can no longer go on that Medicare Part B drug file and find any CTPs. And frequently asked question number 7, are there any CTPs on the medically unlikely edit files or the MUE files? We're getting that question quite a lot. At this time, there are no CTPs on the CMS medically unlikely edits public file for provider-based departments and physicians' offices. A few years back, some CTPs were listed on the MUE file. However, they have since been removed. Some medically unlikely edit values are confidential and not publicly available according to the Medicare contractors. If you want to determine if there is an internal medically unlikely edit file within those MAC jurisdictions that includes a particular CTP, you should pose your question to your MAC's provider services portal, and hopefully they will be able to answer that question. Although, as I said before, they sometimes consider these internal edits for their own use and are not publicly disclosed. So you can always try and ask, but they may not have an answer for you. So some quick reminders as we end this episode: update your electronic health record, your charge systems, your coding system, and your billing system. Remind the facilities that you work with to also update their systems. Document, document, document. None of the documentation rules have gone away. Kathleen and myself have spoken many, many times on the documentation requirements for these CTP applications. Document the amount of CTP purchased, applied, and wasted, even though those JW and JZ modifiers are not in use anymore. If you remember, the JW and JZ modifiers did not affect payment before, so it shouldn't affect anything at this point. Join and continue to watch for the CMS wastage clarification about payment for an adequate amount of CTPs to cover the ulcer surface, the wound margins, and to healthy skin, which will allow for fixation. We are also seeking clarification on whether you can fold product, use two products on the same wound, and so forth. So a lot of those questions have been posed to the MACs and have not been adequately answered at this point. And again, once we become aware of this, we will certainly pass that along to you in another episode. Again, I wanted to thank you for joining and listening to this very important episode. Please send any questions and topics to KathleenDSchaum@gmail.com. And please be sure to send any questions, and we will be able to include the responses in future episodes. And I certainly hope to see you next time. And now I'll turn the program back over to Kathleen.
Well, thank you, Donna, and thank you to all the listeners. I hope that you really take to heart the information that Donna has given you, because they are the facts as we know them today. And as Donna said, if things change, the nice thing about reimbursement readiness is it's very up to date, and we will be able to push out to you any new information. And now we have been doing reimbursement readiness. This is the 18th episode, and we will continue them all through the year. And so it's very important to us for us to know if you are liking them, if there's something you want to have changed about it, etc. So please answer the very short survey that is available to you. Just click on the QR code and complete the survey, and we will read every single answer and try very hard to incorporate your ideas into reimbursement readiness for 2026. And I look forward to seeing you in episode number 19, where we are going to talk about some of the issues around coding coverage and payment for the autologous blood-derived products. So look forward to that. And for now, thank you, Donna, and thank you, listeners.